It's January 24th. It is 6:15. I'm doing some physical therapy. Uh, I have sciatica and I have stenosis in the base of my neck, pinched nerve. Now it goes into remission, and both go into remission, and it can flare up at any time. Like I had sciatica flare ups twice, and as much as I was like in the bed, I don't want to say paralyzed because I don't want people to feel offended, but much as I was in the bed, all hurt and it hurt to like breathe. That was because of yard work. Now, when I first got the sciatica, the metal trash can in the kitchen, I was cleaning it out outside, and I went down. This had to be less than a pound. Less than a pound. I went to grab it and just yank it up like a normal. The sciatica just flirted there. And then, like, since it was my second time, I've still told the story, but since it was the second time that it flared up, the first time the doctor told me just normal, normal activities, go to work. That's the only way to get rid of it. And I'm not a sadist, but like I don't like pain, but like I do. I compare myself to a sports dog. I go there. Now, again, the doing the physical therapy daily will keep the pain away. And I know this 100% because when I do it once, it will keep the pain away for like weeks, if not months. So imagine doing it every day. Now, in my field of healthcare, the mental health, like you have psychopharmaceutical interventions, and that's what the MD, the psychiatrist, they prescribe the medicine. They can tell you how the body, our brain chemicals, and the chemical balance that'll bring. As a psychotherapist, I provide psychoeducation and give instruct people on coping skills. Now, also in the field that I'm in, it's called meeting them where they're at. Now, when I say meeting you where you are, it's not dumbing down. It's not bordering down. It's just, you know what I mean? Find something relatable. So, like I said, when I'm doing one-on-ones, I've lived experience. So it's easy for me to relate to the people I'm working with. Now, some people might look at me as an authority or something like that, which I'm not. You're the expert at your own treatment, individualized, person-centered. So individualized and person-centered, you are and cater the goals to which you're trying to do. But when I talk about meeting them where they are, like I said, I do psychoeducation and I teach coping skills. And coping skills help reduce mental health symptoms. Now, the way I would meet you where you are, say, like, sometimes it's poetic hip hop type quotes, just get like put wrinkles in your brain. I said that to myself like earlier in the week. But sometimes like I'll use the same type of stuff, but an analogy like the physical therapy. Now, as much as people I think physical therapy is a chore, and as much as I think exercise is a chore, I tell you, I don't get endorphins. 100 million things can flood my brain with dopamine. I don't get endorphins from working out. It's a chore. But individualized, person-centered, I'm not going to tell you to go against meditation, fitness, spirituality, whatever works for you, and to help your coping skill or whatever center you and equilibrate you. I'm going to work with you on incorporating that into your wellness toolbox. So when it comes to the physical therapy, I just told you. Because some people, like I can relate. I can relate from a young age to young adulthood to a couple, like I ain't used to meditate. I would have been like everybody else with the meditation. But I'll tell you the meditation works, especially if your mind racing. I never sleep. I sleep more now once I started meditating, and I don't even really meditate no more. I can never go to sleep. I used to say I'm not jealous of nothing, but when a girl used to kiss me, roll over, and then already be snoring before she even hit the other side of the cheek on the pillow. I'm like, how you do that? I don't know how to do that. But for real, like some people feel like even whether it's relationship interventions, whether it's behavioral interventions, the way I'll meet you where you at. Say if you like fitness or you in the stuff like that is with the physical therapy analogy. Now I was at the chiropractor when I'm joking with the chiropractor, like it's basically the same thing. Cause I was going to the chiropractor, and I don't shake meds. Like it's not, I have nothing against meds, but like I said, I'm the psychoeducation, the coping skills to help reduce symptomology, whatever you want to say. I'm not against psychopharmaceuticals, but I'm not an MD. So I don't specialize in that. I don't really deal in that. I got to get a network of psychiatrists to be like, yo, I can refer you. They can hook you up. Not on no funny type time. If you got depression or stuff like that, that's what you go to the psychiatrist for. Even if I was a psychologist, it would still be the same as my clinical social work. They don't prescribe medicine either. You got the psychiatrist, you got the MD doctors, and then you got the nurse practitioners now. I think they beefed that up recently in the last like 10 years or whatever because the shortage in the field. Like I said, Temple had a program. I don't know if they're still running it, that they were giving free nurse practitioner school because it's such a shortage in the field. But that was like 2000. It was probably after I started working in Wilmington because I think I reached out to the nurse. But anyway, that's not because I don't know if I said that before. That's not because we had conversations where she said she wanted to pursue that. But yeah, that's where I would meet you at. Not to be all chest naked and stuff, but that's where I would meet you at because I know everybody. If you're in the fitness, the way I would get it to click to your brain is like, yeah, you can use the coping skills when you need them, as long as you learn them. But doing them daily will keep if it's depression, if it's in person-centered, individualized, the intervention that works for you. Like I said, I've worked with people in the past where they were diagnosed with different things, but then it's like none of the interventions work. And then I asked them more about what they felt like their presenting problem is, or what they think like their mom or their wife would think their presenting problem was. And it would reveal like additional trauma or something like that, not just like depression or anxiety. So when I'm asked, because even during intakes, if I'm doing an intake and like even initial sessions, if it's not an intake during the contracting or whatever you want to say, and establishing the line, I'll ask you what's worked in the past, what hasn't worked. That's what people do. And a lot of times they'll tell you what works. They'll tell you it don't work. I ask why, and they tell you. And then, you know what I mean? Like I said, if no intervention works, like I said, the supervising and stuff like that, I try to be like water. Be like water. And like I said, even with that, it's like, yeah, I mean, I could have a game plan. I could be like, the last time we met, we talked about these 3 things. I gave you homework. I'm going to follow up with the homework. We're going to review some other stuff, and then we're going to go into CBT or strength-based or narrative. Like I said, you never know when somebody's going to come in with a crisis, and I might have to intervene or incorporate crisis intervention. I might have to incorporate some relapse prevention. I might have to. I feel like everything is integrated. Not everything, but like I said, I've told people I use like for adults. I'll use depends on the adult. Like if people don't want to explore the past, I'll use different things in combination with trauma informed and strength based. If you're just normal, I don't want to say normal, but if you have like I'll incorporate like a CBT, some psychodynamic, and then trauma informed and strength based, and then incorporate other stuff like narrative therapy. Like I was working with somebody for like 3-4 weeks, and then they came in and whatever they were dealing with, I had to switch to like a narrative therapy and get them to separate themselves from the problem, and then work with them on how to eliminate or decrease the problematic behavior or problem. Anyway, meeting people where they are, as much as silliness as I be, and And as much as I am going through the fraud and all that stuff, and as much as I promote other things on across platforms, I do take my job seriously, even though I'm not employed right now. And I am. If you're not stalking me, you would think I was normal. If you weren't listening to gossip, you would think I was normal. But I'm trying to be trust naked on here.